afternoon, everyone, and thank you for tuning in to Name That Virus. On today's episode, our patient Rita will be asking each of us doctors a question about a certain disease state. Rita just recuperated after suffering from laryngitis caused by the Parainfluenza virus. Now, before we get started, as always, we will introduce ourselves. I am Dr. Katrina Brand.
I'm Dr. Rachel Eddyburn.
And my name is Rita.
Now, before we get answering Rita's questions, we will go over a few facts on parainfluenza virus. Parainfluenza virus is a helical-shaped, single-stranded RNA that has a lipid bilayer envelope.
It enters the body through multiple methods. It can either be exhaled through droplets in the air or by landing on unsanitary surfaces, which you touch with your hands, and then your hands come in contact with mucous membranes, such as your eyes, mouth, nose, or throat. The virus enters the cell by fusing with the plasma membrane. The hemagglutinin protein binds to the virus at receptors that bear acylic acid on the host cell. The virus prevents phosphorylation of important proteins which aid in the immune response. Airway inflammation, necrosis of respiratory epithelium, increased mucus, and edema of the mucus layer of the larynx are some common damages associated with the parainfluenza virus. The virus exits the body via sneezing or coughing, and it can live up on a surface for up to 10 hours, or it can directly enter a new host. So Rita, what were some of your symptoms?
Well, I had a runny nose, a barking cough, and I also lost my voice.
That's actually very common for laryngitis. Symptoms often include a runny nose, a cough that may sound like a bark, raspy or loss of voice, difficulty breathing or wheezing, and the possibility of a fever.
So how did I get laryngitis?
Well, interesting enough, various animals can serve as the reservoir for parainfluenza virus, such as chickens, monkeys, but you most likely got it from humans. Transmission can occur via the following routes. It can be direct to person through close contact, such as inhaling respiratory droplets, direct person-to-person contact through saliva exchange, such as sharing a drink with one of your friends, aerosols of respiratory secretions, such as coughing or sneezing, or the virus can survive on surfaces and you can come in contact with those surfaces.
Oh, okay. How do the doctors know for sure, though, that I have laryngitis?
Well, when you went to the doctor, he probably took a swab of your nose to take a viral sample. Then he sent the viral sample to a lab where they ran one of two tests, either an RT-PCR assay or an immunofluorescence assay. The RT-PCR assay takes the RNA that the virus has and it makes multiple copies of it so there is a large enough number of it to read. And then you find a standard curve and you look at the concentrations of the parainfluenza DNA that you made per sample. The immunofluorescence assays, they take a set of antibodies that present themselves when you have the parainfluenza virus, and you treat the same RNA samples with the antibodies specific for parainfluenza, and then you read them under a microscope. And it's called immunofluorescence because where the antibodies attach, the special lasers on the microscope light it up, and the larger clusters show the intensity of your laryngitis.
Oh, okay. Well, suffering from laryngitis really put a toll on my daily activities because I couldn't use my voice to its full potential. What are some possible treatment options for laryngitis?
Well, Rita, there are not many treatment options for laryngitis caused by the parainfluenza virus. Because parainfluenza is a virus, antibiotics will not treat this. In order to treat your scratchy throat, you can often use a humidifier that is associated with laryngitis.
Well, how do I prevent something like this from happening again?
Well, Rita, to protect you and your family from getting the parainfluenza virus, you should practice proper hygiene by washing your hands, using your elbow when you cough and sneeze, and disinfecting countertops and etc. to kill the virus. By doing all of these, you will prevent yourself from developing the parainfluenza virus.
Thanks for watching Name That Virus. Don't forget to tune in next week for more virus fun.